Good day, e-learners. Welcome to Local Advocacy 101, an e-learning program by Access California, a program from NorCal MHA. Today, we are going to go over the tools that are necessary to prepare presentations for local advocacy efforts at the county and state level so that more local advocates are included in the consumer stakeholder process and the planning process as advocated in the Mental Health Services Act itself. I suppose a good place to start is with an introduction about Access California. We are a program of Northern California Mental Health America, or NorCal MHA. We are a consumer-led stakeholder advocacy program funded by the California Mental Health Services Act, also known as MHSA or Prop 63. And the Mental Health Services Oversight and Accountability Commission oversees our program and is crucial to our funding system as well. So NorCal MHA was founded in 1946. It's the oldest continuously operated consumer-run advocacy agency in California. And we are very proud to be a peer-run organization that specifically hires people with lived experience to speak from the consumer experience / client experience in the way that we advocate and provide support systems for those affected by mental health services. So ACCESS stands for Advancing Client and Community Empowerment through Sustainable Solutions. Local advocates like yourself that you're learning about are a part of the sustainable solutions that we are planning for. Only by your advocacy will the mental health services in California continue to evolve based on consumer input and stakeholder input in the planning process and beyond. Our values are three parts: advocacy, recovery, and peer support. Advocacy means meaningful stakeholder participation and the active solicitation of community feedback by local planning committees, with expanded opportunities for involvement and inclusions at all levels, including policy development, program planning and implementation, services delivery, oversight, and administration. Recovery is about the infusion of recovery principles in all aspects of service delivery. That includes the tracking, reporting, and analysis of recovery outcomes in all mental health programs. And we are deeply committed to peer support, which is an evidence-based model, and we hope for the incorporation and expansion in all mental health programs, including living wages, ongoing professional development, and opportunities for advancement for those peers. Our Access program includes research, advocacy, education, and engagement. And some of the things that we do are included in legislative and policy analysis, data collection and evaluation, a state of the community report each year, local and statewide mental health advocacy, statewide advocacy conferences, stakeholder training and education, and community outreach engagement, just to name a few. So in this e-learning module, you will learn about the MHSA's requirements for community collaboration and stakeholder participation, as well as various agencies, entities, and bodies that determine mental health policies and services. In addition to access points for mental health advocacy and crafting an effective public statement, and tips on attending and participating in public meetings, so that you feel confident to advocate for clients and consumers and families that are affected by the mental health services. There are 4 parts to what we will be learning in this e-learning module. Part 1 is the MHSA's requirement for community collaboration and stakeholder participation. You're going to want to work from the MHSA essential elements and program component handouts. There are 6 MHSA general standards that were once known as the essential elements. Those include community collaboration, cultural competence, client-driven services, family-driven services, wellness, recovery, and resiliency orientation, and integrated service experiences. Community collaboration is about that meaningful stakeholder involvement so that you, local advocates, feel an opportunity to participate in the planning process. Cultural competence is a general standard to ensure that all communities are included in the mental health services and no one goes overlooked, because mental health affects every family of every background. We also want to note that client-driven and family-driven are two separate standards. They are also two separate regulations, and that is so that client-driven services focus upon adult populations, while family-driven services focus on youth-driven services under 18. Wellness, recovery, and resiliency, as well as integrated service experiences, is about expanding those mental health services that are proven to be effective and evidence-based and more available across the counties and state. Today, we will only focus on community collaboration, and that's about local advocacy and you as stakeholders having meaningful involvement in the mental health policy, program planning, implementation, monitoring, quality improvement, evaluation, and budget allocations, as well as the development of 3-year program and expenditure plans. Please note that these elements are quoted from the Welfare and Institutions Code. Stakeholder is perceived as a big concept. It can include individuals or entities with an interest in mental health services in California, including but not limited to individuals with serious mental illness or serious emotional disturbance, or their families as representatives. It also includes providers of mental health and related services, those representatives of education or educators themselves, and representatives of law enforcement or emergency services, and any other organization that represents the interests of individuals with serious mental illness or serious emotional disturbance or their families. So, what does stakeholder inclusion look like? The MHSA requires counties to preside over a community planning process, and you can learn more about it in the MHSA 101 e-learning module that we also provide. This ensures that stakeholders have the opportunity to participate, as well as it includes representatives of unserved, underserved populations, and outreaches to clients with serious mental illness and their families, and offers training to stakeholders participating in the planning process. All of this may seem arduous, especially from the county perspective. However, they have the money for it. It's in the planning process and it's funded by the MHSA. Stakeholder participation, as required by the MHSA, is about having meaningful involvement in mental health policy, program planning, implementation, and the like, development of a 3-year program and expenditure plans. As I mentioned on the last slide, the MHSA permits counties to use up to 5% of their planning estimate each year for the community program planning process. This slide will give you an estimate of what 5% of local planning means for the community program planning process. As you can see, for a small county like Alpine, that would allocate about $73,700 for the planning process. However, it can grow as much as $20,583,450 if you're in a county as large as Los Angeles. The community program planning process is built to ensure that individuals or families, citizens, agencies, or organizations and businesses have an opportunity to participate and work together to accomplish a shared vision. It also allows for shared leadership, ownership, vision decisions, and responsibility. Additionally, it brings members of the community together to solve current and emerging problems. We at Access wanted to provide supplemental information for the MHSA Program Planning Guidelines. There are two handouts that you can look at, which are the MHSOAC Innovation Guidelines and the MHSA Program Planning Guidelines. They are tools to support the integration of the MHSA statutory standards to the MHSA plans and programs. You may have heard mention of the MHSOAC. That is the Mental Health Services Oversight and Accountability Commission, and it was established to oversee two acts as well as the human resources, education and training programs, innovation programs, prevention and early intervention programs. It was established to replace the Department of Healthcare Services Advisory Committee. Much like the community collaboration, it incorporates many different stakeholders from emergency services, education, criminal justice, as well as consumers and community stakeholders in healthcare and mental health services, and more. The Access MHSA Program Planning Guidelines, as we mentioned, should be used to evaluate the planning process undertaken for any MHSA-funded mental health programs or services. We break them down into three themes that include Theme 1, Advocacy and meaningful stakeholder participation and client-driven programs and services. Theme 2, the recovery-oriented systems, services, practices, and outcomes. And Theme 3, the expansion and strengthening of peer support services, increased stakeholder employment and opportunities with the public mental health system, similar to our three-part values. Access also took the opportunity to write a Stakeholder Bill of Rights that includes 6 standards for local advocacy and those stakeholders participating in the community program planning process, including transformation, information, education, representation, participation, and consideration. We will review them further along the next slides. However, they are also available on the Stakeholder Bill of Rights handout. Now let's review the Stakeholders Bill of Rights. It starts with transformation, because we as stakeholders have the right to a public mental health system that embraces the recovery model of care and is fully committed to all general standards for programs and services set forth by the MHSA. Number 2, information. We as stakeholders have the right to full transparency in our public mental health system. Number 3, education. We have the right to fully understand the meaning and implications of facts and data relevant to our public mental health system. As we continue with the Stakeholder Bill of Rights, we start with number 4, representation. We have the right to a competent and adequate representation when important decisions are made in our public mental health system. Number 5, participation. We have the right to shape policy and meaningfully participate in all important programming and funding decisions in our public mental health system. And number 6, consideration. We have the right to submit grievances to our public mental health system, to have our grievances acknowledged, and to receive thorough and timely response to our grievances. We wanted to give you things to think about as we continue to move forward. These are 2 questions that we're working on to figure out more information about advocacy at the county level. How are stakeholders currently being utilized in your county's community program planning process? As well as, do stakeholders approve the plans or are they involved in developing the plans? We are now on to our second part, which includes learning about agencies, entities, and bodies that determine mental health policies and services. So let's review the local level decision-making process. It should begin from the bottom up, with the MHSA community planning process, as well as a cultural competence committee. Those 2 collaborate to to feature unmet needs that are developed from the stakeholder process to the Division of Behavioral Health. behavioral health department should then devise a program to meet the needs or unmet needs of the community that were developed from stakeholder feedback. In some counties, the MHSA community planning process or the MHSA steering committee is actually a subcommittee of the mental health board and therefore is taken in place into the third round of decision making. The county behavioral health department should bring decisions and plans to the mental health board that may include an MHSA community planning process, and then onward to the local board of supervisors or city council for final approval at the county level. The question still remains how to get involved or when to get involved. Or how do I know about these meetings? The good news is that the Brown Act open meeting law requires that local agencies and committees post notice and an agenda at least 72 hours in advance of any regular meeting. This ensures citizen and professional involvement in meetings. The Brown Act also requires that they treat every document as public. And this is the answer that you're looking for. They must also provide time for public comment in any public meeting. The other things to look for is that, according to the Brown Act, these agencies must also notify the media and hold free of charge meetings in places that are accessible to all and not require a sign-in for anyone, and to allow non-disruptive recording, and to allow the public to address the board at regular or committee meetings or on any item in the agency's subject matter jurisdiction. If you remember the flowchart of decision making, it all finishes with the Board of Supervisors. The Board of Supervisors is the governing body of the county. They review and approve 3-year program and expenditure plans, as well as annual updates for MHSA programs and expenditures. If you're looking to get more involved with the Board of Supervisors or have questions about meetings or agenda items, your contact will be the clerk of the board. Their contact information is generally available on the county websites. However, we also have a list on our accesscalifornia.org webpage for the local directory. You may remember on the decision-making flowchart, there was also the mental health board or the commission. So you may be wondering, who are they? They're about 10 to 15 members or 5 in smaller counties. 1 member is on the Board of Supervisors. While members must have experience or knowledge of the mental health system and reflect the ethnic diversity of the client population. It is also imperative that 50% are consumers or parents, spouses, siblings, or adult children of consumers. If you have questions about the Mental Health Board or Commission meetings, please contact the Board Executive Secretary. Their information should be available on your county's website. However, not all counties list it, so please contact the Department of Behavioral Health. So, we just reviewed who the Mental Health Board or Commission is. Now we must ask, what do they do? Generally, they review and evaluate the needs, services, facilities, and problems of the local county mental health services. They also advise the governing body and local behavioral health director. And they ensure that citizen involvement is included at all stages of the planning process, while making recommendations to the local director of behavioral health services. They also review the county's performance outcome data. There may also be subcommittees or represent specific interests or projects. For example, there may be a subcommittee of the Mental Health Board or Commission that involves just stakeholders, or focuses on older adults, minority advisory, family and adolescents and children, or the budget and funding oversight, just to name a few. From the decision-making flowchart, you may remember the MHSA community planning process. Now, there's no commonly agreed upon description. It may vary from county to county. However, there should be a structured process that counties use, and that is to engage the community in discussing the impacts and effectiveness of MHSA programs, as well as collect stakeholder input on current and future planning, and to define the populations that need to be served, and determine strategies to provide effective services. The MHSA community planning process is supposed to make program plans and recommendations for county mental health services, promote wellness, recovery, and consumer and family-driven services, while making the system easy to access, responsive, and allow maximum consumer choice, as well as to focus on outcomes that improve stakeholders' quality of life. If you're looking to get involved with the MHSA community planning process, you're going to want to contact the MHSA coordinator for the county. This information should be available on your county website. If it's not, you can also use the accesscalifornia.org local directory for local advocacy efforts. Another decision maker from the flowchart earlier was a local public mental health agency. The agency provides a locally run public mental health system that's supposed to provide services for individuals in crisis, for youth, for adults, and for alcohol and drug treatment. Last, we will review the Cultural Competency Committee. They were one of the decision makers on the flowchart as well. And what they do is participate in and review MHSA planning. They participate and review services and programs and cultural competence plans and their implementation. It is important to note that the Cultural Competency Committee is designed so that no underserved, unserved, or inappropriately served community is excluded from the mental health planning at the local level. If you'd like to get involved with the Cultural Competency Committee, do seek out the Ethnic Services Manager for your county. This should be available on the County Behavioral Health Services webpage. However, if it's not, please review the Access California local directory on accesscalifornia.org. We are here to promote local advocacy and to teach you how to do it. So, let's get involved. Identify current stakeholder opportunities that exist in your county. You are a local stakeholder. Get involved. And are there any missed opportunities for stakeholder input in your county? And fill that void if there is. So, when do you advocate? There are 5 phases to the planning process. Phase 1 is about gathering information. Phase 2 is about the planning process. Phase 3 is about input on proposed planning. Phase 4 would be the final approval, and Phase 5 is the publication of final results. With the color scheme, you can see that the highest impact is going to be in Phase 2 of the planning. This is with the MHSA Program Planning, Advisory, and Stakeholder Steering and Strategy Roundtables. This is when all local stakeholders are included in the planning process and have their voice heard in the way that they see unmet needs are being addressed in the community, or they aren't. The second highest impact would also be in Phase 1. So you're going to want to get involved early. If you're in Phase 1, be in Phase 2 as well. This is about gathering information with kickoff meetings, needs assessment, focus group surveys, as well as key informant interviews. This is about addressing the needs that you see as necessary in your community. Here we are at Part 3 already. Crafting an effective public statement. After learning about the community collaboration and the imperative of stakeholder involvement in the community planning process, you should feel pretty empowered into the idea of moving towards participating in local board of supervisors or mental health board or commission meetings, or as well as interacting with the behavioral health department to give your piece about what is necessary or unmet needs are in the community. You are learning to become an effective advocate. The number one most important thing to do is understand the issue, know what you're talking about, and be an authority on it, as well as selecting your forum and knowing your audience. You may be in different situations to address either a Board of Supervisor member or as well as a local police officer who's a community stakeholder, or it could be a neighbor, a family, or friend that you're addressing. Know how to address them appropriately. You need to understand the meeting guidelines so that you can prepare a strategy for either developing a 2-minute section or a 3-minute section, depending on when and how public comment is made available. And the most important part is to make your point. Be concise, be confident, make your point, and leave them with a good impression. The most important aspect of being an effective advocate is to understand the issue. Here are some general questions to ask yourself to understand more critically about the issue you're dealing with, especially how common and widespread is the problem, or how did we get here, which provides historical context. Additional historical context can be said about what has been done or hasn't been tried, and then also what might work and why it would work. You can speak from experience. That is an informed opinion from personal experience as a consumer or client. You can also speak from an educated perspective of what you found in research or what you found in pilot tests in other counties that you've heard about that might be working. And then also to recognize what are competing interests, what may be at stake, or who may be at stake. Are you addressing the concerns of one community over another? Please be sure to think about these questions when developing your understanding. Selecting your forum is a crucial element to where you will make your public statement. Remember from the previous section that there was 4 or 5 elements to the decision-making process. Now you may address the Board of Supervisors at time of approval. You may address the Mental Health Board or Commission in the planning process or approval, or you may also address the Mental Health Department. And so the way that you influence the community with your public statement means you have to analyze what authority or influence does this body have to address the issue. Who is this body accountable and how? And why is this the most appropriate place to make your statement? Remember that selecting your forum involves where to be most effective, whether you want to start in the informative period or planning period or the approval process. Please take an opportunity to watch this public address at a city council meeting to ensure your understanding of a public forum presentation. If you have an opportunity to know more, know the most. So what does it mean to know your audience? That could mean, what are the political backgrounds or leanings of the members you're addressing? What do they care about? How have they voted on similar issues in the past? What arguments might be most convincing to each member? Remember, staying informed and staying involved will be able to help answer some of these questions. When you're attending more meetings, you'll also have an opportunity to learn about the process as well as learn about the people and make more convincing arguments based upon the way that you experienced past meetings. Another important aspect is understanding the meeting guidelines. One of the primary questions to ask is the issue you're speaking about on the agenda? If it is, then you can address it on that agenda item when public comment comes up. Otherwise, you may need to wait until a general public comment section is available. As well as, how much time do you have to speak? There are different limitations based on the meeting parameters. Again, experience will help to be able to give you guidance in when you're ready to address your public statement. And are there any other procedural rules that the body follow that you need to keep in mind? These include following the Brown Act, the Bagley-Keene Act, city or county ordinances, as well as bylaws and Robert's Rules of Order. So after getting to know your audience, as well as understanding the guidelines, you're going to want to develop a strategy. Here are some questions that you may want to answer in addressing your public statement. You want to be clear, you want to be concise, you want to address each of these things in a presentation that is effective in addressing what your interests as an informed advocate. Here's an outline to make your point more clear. You're going to have 3 substantial elements to your presentation, including an introduction, substance and supporting arguments, as well as a conclusion. There's going to be an introduction of who you are and where you're from, your issue, as well as state your ask and exactly what you want the body to do. Your introduction should be about 3 sentences. Any more than that, you're going to be talking a little too much. In your supporting arguments, you want to address the issues of how the issue is impacting you, people close to you, people like you, or the community at large. This is part about being informed, as well as why is the current situation not working or the proposed action ineffective? What is the possible solution? And why is this solution better than the status quo or the proposed action? This is the bulk of your statement. You're going to want to address it in several sentences to lay out the meaty part of your public statement. And in conclusion, you restate your ask or exactly what you want the body to do. This is to readdress the point of your giving a clear and concise statement, as well as thank the body. And in total, you should be averaging about 12 to 16 sentences, and that should keep you within a 2 to 3 minute timeline as far as public comment can address. There are 3 factors to consider. The first is, who is my audience? There's an elemental difference between the timing and setting if you're developing a one-on-one conversation with a client or a work team or a coworker, or if you're in a structured speaking environment. The culture and norms of the listeners change, as well as the timing and the settings. You're also going to want to ask, why do I want to share this information? There are 3 points to it. They are, is it relevant? Is it helpful? Who does this help most? Are you venting and helping yourself? Or are you creating a presentation that is beneficial for everybody to understand better? And the age-old question is, how much do I share? How much do I present myself relative to the subject? You want to be personal, but you also want to be effective, and you don't want to be too emotional. Those will get you carried away in your public statement. So there are different elements that happen when sharing's done right. You inspire people. You also build mutuality and reinforce equality. You can create trust and provide a model for change. There's also the idea of reducing stigma as being a representative for yourself, or educating others about subsections of populations or clients or consumers or unserved or underserved or inappropriately served communities, as well as promoting personal empowerment. Going in confidently really boosts your ego, and you will feel great and ready to address the next situation after another information session. There's also the flip side. When sharing is done wrong, it can discourage hope or reinforce power imbalances and create triggers or re-traumatize those listening. It can keep people stuck in an idea or increase stigma or decrease credibility. And you don't want to do that. Being informed helps you feel being prepared. However, practice is essential. People who do not practice their statements are more likely to overshare, dwell on the negative, regret their choice of words, or experience strong emotions that interfere with their statements. Practice, practice, practice. Let's take a look at another public statement, and we'll address questions on the next slide. Here are some questions that you're going to want to think about. Was he speaking about an agenda item or making a general public statement? How can you tell? What went wrong? How do you think the audience perceived him? And how might using the advocacy worksheet have helped in this situation? Remember, this is Local Advocacy 101, so let's get started with getting you involved. You're going to want to start with step 1. Think about an issue that you would like to advocate for. It could be an individual. It could be a community. It could be a service. It could be yourself, but you want to be informed and you want to present it with confidence in the way that you're addressing your issue. Step 2. Using the Making Your Point section of the advocacy worksheet as a guide, prepare a 3-minute public statement. This is going to work from the advocacy worksheet handout. We will finish this section with a set of inspiring words from Maya Angelou. People will forget what you said. People will forget what you did. But people will never forget how you made them feel. We will conclude with our 4th and final part. This is tips on attending and participating in public meetings. As we left off with a quote from Maya Angelou, it is important that impressions matter. What do you want people to say about you after you've made a public statement? Address these 3 bullet points with answers about what impression you want to leave. Concentrating on these goals will set you up to be the change that you want to see. Here are some additional tips about making a good impression. You're going to want to dress the part. Again, know your audience and where you will be. Be positive. Make eye contact and try not to read your statement. It's important to use a conversational tone. And consider a first-person statement to build the connection to the issue. Focus on one issue at a time, offer solutions, and submit a written copy of your statement if possible so people can follow up with you or your issue and in concrete matter. If you're having trouble gaining access to local or state mental health agencies, Access California has a stakeholder ombudsman and advocacy helpline. This allows stakeholders to report barriers to participation and perceived violations of the community program planning process, and allows access to review complaints, conduct research, and we will initiate issue resolutions with state and local mental health agencies. It is also there as an advocacy helpline. We can help navigate our local and statewide advocacy directories that's available on our website, as well as assist in advocating for local mental health needs on the local and grassroots level. The numbers provided below: 707-572-HELP. That's 707-572-4357. In order to recap what we learned today, we want to remember that we addressed the political origins of the MHSA, as well as the MHSA's core principles or the general standards, the local level advocacy opportunities that are present at the county level, as well as the structure and flow of public meetings, and crafting an effective public statement. If you need to contact us, the websites that were mentioned in the previous e-learning program for Local Advocacy 101 are available here. That's accesscalifornia.org. You can find us on email, or you can contact us by phone for the office or the helpline, the Advocacy and Ombudsman helpline. And if you want to connect with us, find us on social media, Facebook and Twitter.